Okay, and welcome everyone. I'm Mark Pinto from Phoenixville Public Library, and welcome to tonight's presentation, Understanding Cognition and Cognitive Health for Older Adults. We are recording tonight's presentation for our YouTube channel. We ask that you type any questions during the presentation into the chat box. You'll have an opportunity after the presentation to unmute yourselves to ask a question. We're glad to have back with us on her second Zoom tour of duty with Phoenixville Library, speech language pathologist Emily Overbaugh. Emily, welcome, and turn things over to you.
Okay, thanks, Mark. Thanks for having me. And thanks everybody for joining tonight. You may not realize it, but actually by joining tonight, you're doing something good for your brain. So we're going to talk about why that is here. But as you can see, my topic is understanding cognition and cognitive health, really for everybody. So before we get into that topic and before I kind of introduce myself here, I want to give a bit of a memory challenge. I am going to give you 10 words that I want you to try to remember, okay? I want you to do your best to remember these 10 words. You're not going to get a report card or any kind of grade, but I want you to participate in this challenge with me, okay? So I'm going to read the words here now twice, and then we're going to come back to them later on, okay? So our words are market, package, elbow, apple, story, carpet, bubble, highway, saddle, powder. Okay, now I'm going to read it again. Don't panic. Okay, market, package, elbow, apple, story, carpet, bubble, highway, saddle, powder. Okay. All right, so we're going to move on and we'll come back to that later. So just a brief introduction, a little bit about me. As Mark mentioned, I'm a speech language pathologist. And so that means I'm certified by the American Speech and Hearing Association. And then some of my interests in working with patients are patients with mild traumatic brain injury or concussion. And so I recently got my certification to become a brain injury specialist. And then I also work frequently with patients with Parkinson's disease. And that the other certification listed there is the LSVT program, which is a program for patients with Parkinson's disease. And then down at the bottom, that is my practice in the area where I offer services for individuals in their home or via teletherapy. And I've been working for about 10 years in the field. And one of my big interests is cognition and cognitive health. And a lot of people ask me about this topic and how they can promote ongoing brain health. So that's what we're gonna talk about tonight. One of the things though, that people wonder is, what exactly is speech pathology? What kind of things do we do? Speech pathology is a bit of a misnomer in that the umbrella of speech pathology includes several different areas. Yes, we do work on speech if that's the need the patient has. So sometimes patients come, I work primarily with adults 18 and older, and sometimes patients do come with concerns about their articulation or the fluency of their speech. But then some other areas that we work with are language and communication. So the ability to get your ideas across and also understand what other people are saying to you. We work with patients on their voice and voice quality. Believe it or not, we also work on swallowing. So if you've never had someone who needed speech pathology services, you may not know that one of the areas that we help patients with is eating and swallowing safely. And then under our umbrella as well is our cognitive skills. And we talk about cognitive skills. That's really just a clinical or sort of medical term for our thinking skills. So the best way to talk about what cognition is to talk about the areas that fall under cognition. Unfortunately, there's not one big consensus on what our cognitive skills are. They're kind of hard to define and to pinpoint, but generally the areas that I put up on the screen are the different areas that we talk about when we talk about cognitive skills. Most commonly, people ask me about, or people come with concerns about memory. And oftentimes people will say, you know, my short-term memory is giving me trouble. And one of the things that people are sometimes surprised to learn is that memory is much, much more than short-term and long-term. I could give a whole Zoom talk on memory alone. Memory breaks down into many different areas. We have memory for recent events. We have memory for information we're receiving in the moment. We have memory for things like how to drive a car or how to tie our shoes or various skills that we've acquired. So the next slide will show a breakdown of how many different kinds of memory there are to talk about. We also include attention in our cognitive skills. So attention can mean our ability to pay attention to one thing for a long period of time, our ability to pay attention to two things at once. For instance, having a conversation in the car while someone's driving. And our ability to go back and forth, paying attention to two things and leaving off and coming back to where we left off. Our executive functions are these really cool skills. One of my favorite areas to talk about. Our executive functions include our ability to plan, manage our time, organize, basically our ability to get things done in the world. So how do we have control over our daily life and how do we keep everything going as it should? And then we have problem solving, which means exactly what it says, how we solve problems in our daily life. But that can look like how we, figure out the best route to get somewhere or how we balance our checkbook. Language, our ability to express our thoughts and ideas and understand. Processing, how rapidly we understand information and how quickly we can make decisions about what we hear. And then some other skills like our visuospatial skills, which is like our awareness of the space around us and how we navigate it. And then perception and sensation, how we feel and see and experience the world. So all of these skills fall underneath the umbrella of cognition. So I'm not going to go through each of these areas, but you can see here that it's a laundry list of different skills that come underneath those areas. So they break down even further. Okay. But what I think is really helpful or really most interesting is to think about the skills that we use on a daily basis and how they're used. So for instance, attention, I mentioned driving, an area of memory called our declarative memory, remembering our grocery list or names of people. That's a big one that I get, that people struggle sometimes remembering names of people that they've met recently or people that they've known for a really long time. And it sort of takes them off guard that they don't know their name. there's those executive functions, again, planning out a future activity. I really like the example for visuospatial skills, furniture layout. So, knowing how much space we have to work with and making decisions about that, that's a cognitive skill. Um, and I would argue that everything we do in our daily lives has a cognitive component. And then last on the screen, there's working memory. So working memory is the kind of memory where we hold information in our head while we do something else, like remembering a phone number and dialing the phone. So these types of skills are throughout our daily lives, everything that we do. So when we think about what can impact cognitive functioning, it generally falls into these areas. Normal aging can impact cognition, and we'll talk about that in a minute. But just like our vision or our hearing can change over time, so can our cognitive skills, and so do our cognitive skills. Other things can prematurely affect our cognitive functioning or make the impact more significant. Things like illness or injury, like brain injury or stroke, or an illness like dementia. Those things can speed up a cognitive decline. And then we have other factors that aren't necessarily captured there, like a temporary factor, like having too much to drink, for instance, can make you cognitively not function as well. Things like processing speed and language. And then mental health. So certainly when people are in more stressed or anxious states, they don't process information as well. They don't remember information as well. So that's something to consider, with the stress that everyone's been under the past year. And we'll talk about stress. This gave me pause when I was reading this research. There are some research suggests that we can start to experience a cognitive decline as soon as our 20s and 30s. Yes, we all read that correctly. So there's not a consensus necessarily that this is exactly when we see this happen, but we can just generally be sure that into adulthood, we can start seeing changes in some of those skills that I showed earlier. There's a couple pieces of good news, though. The good news is when we do a comparison of our crystallized versus our fluid abilities, we see some differences. So our crystallized abilities are our knowledge, the things that we've spent our whole lives building up, our base of knowledge, our skills, our memories. Those things actually tend to get better across the lifespan. We learn more and we acquire more skills into adulthood. The things that take a bit more of a hit are our fluid abilities. So things like being able to process new information and remember new information. But the extra good news is that we can potentially make a difference in how our brain changes over time and how our cognition changes over time. So while there's no magic cure to the changes that come with aging, there are things that we can do to promote better cognitive health longer. So here are some of those factors, and we're going to talk more specifically about some, but this is just an overview. The first one listed here is a healthy diet. So we know that diets rich, in fruits and vegetables, as well as healthy fats like olive oil and nuts. I can also send out a whole list of consensus after this, a list that provides a consensus of some different foods that are generally good for our brain health. But in general, a healthier diet can contribute to good cognitive functioning over time. Similarly, physical exercise, avoiding excessive alcohol consumption, participating in cognitively stimulating activities, and that's going to be a big focus here too. Managing emotional stress and managing chronic medical conditions. I've chosen a few of these to talk about a little bit more in depth. So the first one is physical activity. It's not just that physical activity is good for our cognitive function, it actually can potentially delay the trajectory of cognitive decline, and in some instances can enhance our cognitive function. And what we see that is individuals that participate in the most physical activity have a lot of benefit to their executive function. So those skills that I mentioned, being able to be on top of things, plan and organize and manage your time, those really high-level skills, it tends to be those that engage in the most physical activity have the best executive functions. So if we get more specific about that in terms of physical activity, we generally look to the AHA, the American Heart Association guidelines, physical activity for a minimum of 30 minutes, 5 days a week, or vigorous activity, 20 minutes, 3 days a week. And that's when we can start seeing the potential benefits. This is important too, managing our emotional stress. So in the short term, stress can impact our ability to form memories, process information, decide what information is important and what information isn't. And then I find this somewhat interesting that in the long term, release of stress hormones in our brain can actually impact cognition. So repeated release of stress hormones is not a healthy thing for our brain. So in whatever form managing emotional stress comes for you, that is a positive thing to do for you, not only for your overall health, but it also includes your cognitive health. So that can include things like speaking to your doctor about medications or therapy or self-care activities that can reduce your stress, whatever is appropriate for you. And that looks a little bit different for everyone. And here's where I really come into play in terms of a level of expertise. So I'm constantly encouraging my patients to engage in what we call cognitively stimulating activities. So a little bit about this term, and it feels vague right now, but hopefully it will come into more focus as I talk about it. Generally, cognitively stimulating activities are activities or exercises that truly challenge your ability to think. And the rationale behind this is that we know that if you build up a bank of skills and knowledge over time, if you acquire a cognitive illness that changes your cognition, for instance, dementia, we know that patients who are at higher cognitive reserves, who have a better bank of skills and knowledge, do better over time. So we want, throughout the lifespan, people trying to learn and gain as much new information as possible. New information, new skills. And that can help us potentially delay cognitive decline or deal better with it once we experience it, which, as we mentioned in the beginning, we all will and we all do. But more activities at once is not necessarily better. We want to choose activities that are complex and that we can feel like we're really interested in and want to dedicate our time to. So I'll back up for a moment that this terminology comes from something called the Global Council on Brain Health, which is a group of professionals, scientists, researchers, clinicians that came together to make recommendations about brain health. And I'll share with Mark the links to some of this when we're done that he can disseminate to the group. But generally, the general idea is these practitioners came up with some recommendations to follow, going into more detail with physical activity and nutrition. And then what I've included here are the guidelines for choosing cognitively stimulating activities. So you can see down at the bottom, some examples are things like learning a martial art, taking a photography class, investigating your own genealogy. Not sure how many people are trying to juggle right now, but that might be a thing you would like to do. Cooking, gardening, learning how to play a musical instrument. The list goes on. Learning a new technology. Some of them could be more simple to implement than others. For instance, they list creative writing or making art. And some are a little more complicated. For instance, learning a martial art. Volunteering is also mentioned. Hopefully, as the situation in our world improves, that might be a little bit more realistic. Also wanted to share with you that there's something called OLLI, OLLI, and what it is a program for older adults 50 and older, and it's actually run through Temple University, but it's run through universities across the country where they utilize the resources of the university for classes that you can sign up for a semester worth of classes about a topic of your choice for a fee, but currently they're offering it virtually as well. So it's another good, resources like that where you learn, as I mentioned, learning new information is the first thing, a new information or new skill. And the second thing would be if you can add a physical component, you kind of get a double bonus. So that's why things like gardening and learning a martial art, those kind of things are listed because they also have the physical component. A couple other things to keep in mind. It's good for us to, pick up old activities that maybe we liked before that we've let go. And don't limit yourself. There's always a way to overcome a challenge. If you share with other people that you're trying to do something new, usually, people around you can support that. And that leads to the idea that social engagement can be really helpful too, which is hard right now. But just by doing something like this tonight, utilizing technology, trying to learn information, engaging socially, those are all really positive things for our brain health. And, as I mentioned, there's no guarantees, but these are some practical things that we can do for our brain health. I wanted to mention this briefly as a related topic. There's something in the rehab therapy world that we call neuroplasticity. So our brain's ability to be plastic, to change and reshape itself over time. And there's been a lot of research that's been done with patients who have had injuries to their brain to determine how best to recover the function of their brain. So I want to point out a few things that I think apply to this topic tonight. You'll see the dark green bubble. Repetition matters. It matters how much we do something. That directly relates to how well our brain learns it. We know how to do certain skills because we've done them over and over again. The more you do something, the more your brain can find a pattern and learn. In addition, that red bubble on the left, intensity, how much effort and energy we put into doing or learning something, can also directly relate to learning. Right in the middle there, we've all heard the phrase use it or lose it. And it's true. The skills that we use frequently and try to re-engage in frequently are the ones that our brains tend to hang on to. The lighter green bubble, salience. Salience means how important something is to us, how relevant something is to us. So if we choose activities or skills that we're really interested in, that feel important to us, it tends to be more beneficial for our learning. One of the questions I get pretty frequently is about cognitive apps. So everything in this world right now, there's an app for that, right? So people ask me about things like Lumosity. You may have heard of this or other sort of brain games. And there's definitely a place for these. However, there's not been convincing research that doing brain games necessarily contributes to improvements in your daily life, so in your daily skills. So one of the things that I tend to encourage people to do is try to do something more complex. Like it would be better to try to learn something new or get volunteer rather than the brain games. It's not that there's not a place for them. They have their value, but the research tends to suggest that people get better at the games, not necessarily better in their daily life. I also wanted to take some time and just share some tips and tricks that I've kind of picked up along the way, taught my patients along the way, and that, to be honest, my patients have taught me. So, so much of what I do is collaboration with people to find out what works in their daily life. So, I wanted to share some things with you here tonight, and hopefully, you can take something from these next couple of slides to apply. So, when we talk about tips and tricks for cognition or memory, we can think about two types of things: internal things, things that we do inside of our brain, inside of our mind and our thought process, and then external. Okay. External would be ways that we change our environment or things, tools, physical tools that we use to help us with our cognitive skills. Internally, we can do things like rehearsal. So rehearsal simply means repetition of the same information repeatedly. And as I mentioned before, that actually makes a very observable difference in how our brains learn, how many times we've repeated the information to make a solid memory. Associations, so linking the piece of information to something important to us. So the best example that I have of this is when patients have trouble forgetting or trouble remembering my name. I usually ask them if they have an Emily in their family or friends. 9 times out of 10, they know an Emily or can think of an Emily that they've known before. And usually just that moment of making it personal to them can help make a difference in how well they remember that name, remember my name. So anytime we can link something and make it personal to us, the better. The next one is something that I try to reinforce a lot: heightened attention. So attention is the building block to all of our cognition. If we can't keep our concentration on something, then we probably won't be able to remember that information or problem solve. So when you want to remember a piece of information or when you want to be successful in a task, the most important thing you can do is harness all of your attention to that task. We kind of live in a world where we're constantly multitasking because we have phones with us all of the time. We have a lot of distractions. We might be in a crowded home because of the pandemic. The most important thing we can do is focus all of our attention on the thing that we want to remember or be successful at. Another, a more fun one is using music, tunes, rhythms, rhymes to help us remember. So many, I won't say everybody, but you might be able to think of the little tune or the little saying for the months, how many days are in the month. 30 days has September, April, June, and November. Some of you might be familiar with that. It's just like a fun way to try to remember how many days are in the months of the year. But you can probably think of other little rhythms or rhymes that have helped you remember things in the past. I've also listed on here spaced retrieval. So not only repeating something's important, but testing yourself after some time has gone by. So sometimes with my patients who are having a lot of forgetfulness, I'll have them repeat the same information 2 minutes later, 4 minutes later, 8 minutes later, and so on to kind of constantly be testing themselves. Another good one is visualizing or taking a mental picture, creating a mental image in your mind. Some people tell me they're better visual people. So again, I won't speak for everyone, but many of us may have had that experience where they go into a room and they can't remember why they went in there, or they can't remember, they know they just had something and they can't remember where it was. Closing your eyes and visualizing your steps or visualizing the process that came right before can be a really positive thing. Also, along with that is not panicking, just kind of staying in a calm state so you allow your brain to process. Generally, the more senses that we have involved, the better. So when we want to pay attention, remember, it's good to write, it's good to listen, it's good to repeat. As much as we can engage all of our senses in paying attention and remembering, that can benefit us later on. Some external things that we can do, it's like I've already mentioned a bit, returning or reducing our environmental distractions. So doing things like turning off the television when we're having a conversation, or silencing your phone so that the repeated noise from your phone doesn't distract you. And then in being really intentional about how we organize our environment. So everything has a place and everything in its place. It's an old adage, but it can really reinforce memory for where we left things and where things are or where they should be. If there's a intention to our environment, if we know we put the remote in the same spot every time. Along those lines, getting in really good routines can be a good thing too. I know everyone's routines might be slightly different now, but the more routine-based you can be, the more predictable your day is, and the more that can benefit your cognition. Writing things down, good old-fashioned pen and paper, you can't go wrong. There's also, on majority of phones nowadays, note-taking apps where you can write information on your phone. There's also a function on most phones. I will actually say every patient that has brought a phone to me has some version of this, a voice memo. So where you can leave yourself recordings of your own voice to remind yourself to do something, or just a piece of information that you didn't want to forget. There's a lot of technology now that you can interact with and ask it to do things. So Siri, for instance, Siri does not just look things up on the internet. She also will store appointments for you and make reminders. So I'll try to demonstrate now if she'll cooperate for me. Hey, Siri.
ahead.
Can you set an appointment for me?
What date and time is your appointment?
Tomorrow at 3 p.m. Okay, so I got a confirmation from Siri, and obviously not everybody has an iPhone, but there are versions of this on computers and laptops and cell phones. Just whatever you do have in your environment, use it to your advantage when it comes to memory and attention. Of course, then I also mentioned, some more low-tech options as well. Things like keeping a pocket calendar with you all the time, having a whiteboard that you update on a daily basis, putting visual cues around the house. I love this one because it makes me think of my mom. My mom used to put a sign on our sink that said, "No dishes in the sink." She always wanted us to put them in the dishwasher. And that was like our prompt, when we were about to do it, we would remember to put it in the dishwasher. Probably some brattiness going on there, but the point being that she knew if she posted a visual reminder of something, that we would probably be more likely to comply. And then I say the word journal loosely. When I say journal, I mean like just documenting things that happen on any given day so you can go back and refer to it at a later time. If you have a smartphone, this could be a screen that you might want to take a picture of or write down. I'll give you a few moments to write down these. These are apps for smartphones and tablets that help with daily organization and reminders. So Todoist, for instance, is a to-do list app where it keeps track of the things that you need to do. And you can check off when it's completed. The app that's mentioned there, Pillboxy, is a way to keep track of your medications. And actually, you can describe what the medication looks like, take pictures of the medication. And it's just a really helpful way to manage your medications or a loved one's medications. So all of them have slightly similar or somewhat similar features, but if you're interested in adding to what you may already have on a smartphone or a tablet, these are some suggestions. Okay, so I was hoping that you could either unmute or use the chat and just kind of share what words you remember from the beginning of our session here. If you, like I said, you can either type it in the chat or you can unmute yourself. If you remember any of the words that I gave you in the beginning, go ahead and tell me them now. Don't be shy.
Market.
Good. All right.
Package, elbow. I remember saddle and powder. And that's about it.
All right, good. Thank you. All right, that was good. We're getting a lot in the okay, Janet had a lot as well. Okay, we're getting carpet, package. I think we might.
Apple and
highway.
All right, so I will tell you as the answers continue to come in, because I'm still reading some in the chat. I think you guys got all 10. Very good. I will tell you that this is part of a cognitive assessment that I give to patients like the first day they come to see me. So you can imagine that some people may not want to come back to see me, but I try to do other things. So the reason that I gave all 10 is to give you the real experience of what I actually give to patients. So I would like you to keep your chat open and unmute again. And I want you to tell me how you all were successful. So what did you do in order to recall the words?
I thought that I like to go shopping at the market, and that a package is something that you might buy at a market. And then I pictured myself holding a package with my elbow sticking out.
Love
Apple,
it.
apple sounded a little bit like elbow.
Okay.
Nice.
That was great. Okay. And somebody added associate. So I'm sorry. I apologize that I couldn't tell who was chatting there, but thank you for your response and thank you for the responses in the box. So not only did you all do that before we even talked about strategies, but also you did some that we didn't even go over. So things like storytelling, or we did talk about visualizing, imagining yourself at the market with a package, and generally making it personal to you. Now, I didn't tell you this, but you could have written them down, and that, you know, that is not necessarily cheating in this instance. It just helped you remember, right? Okay. Oh, so we got a response that somebody wrote them down, which is good. It's a memory strategy, right? So it's about strategizing. There's also a share. The first four were related. Okay. So people felt like it was easy to relate market, package, elbow, and apple. Those were kind of easy to visualize, and then it got harder, or relate, and then it got harder as it went on. So everyone, you know, it seems like used some sort of strategy, repeated. Okay, we got to repeat it. Good. And you notice as I'm reading off the responses and as people are sharing, that no two people did exactly the same thing. So the key is trying to take in the strategies and figure out what works for you. And it may not be one thing, it may be more than one. But the idea is, when the very first most important thing is when I said we're going to come back to this, I would imagine that it kind of got people's attention, right? Like, okay, I'm going to do this. I'm going to remember these words. And so that attention, that desire to remember something is a really important step. So thanks everybody for the contribution there. So the last thing I just wanted to talk about was concerns about cognition. So if we know that changes in our cognition are a part of normal aging, then when do we seek help if we're concerned? So the best response that I can give is if changes in any of the skills that I mentioned are impacting your daily life, your ability to function or complete the daily tasks and activities that you want to do, that's time to consider getting some support. Where can you get support? So first and foremost, typically we have the typical route of getting support is usually to go to your primary care doctor and discuss your concerns. And then from there, they might make a referral to neurology or neuropsychology, who neuropsychologists specialize in the both neurological function, but also mental health and psychological function. They do both. So cognitive skills and psychological function. And then speech pathology, which is me. Those specialists would then refer to someone like me or one of my colleagues to provide therapy and intervention, and maybe more specifically tailor what strategies and activities might be beneficial. I listed some just general resources. The Department of Health and Human Services has information on aging. American Speech and Hearing Association is a place where you can access speech pathologists local to you. And AARP, I need to give them more specific information. AARP is the group that sponsors the Global Council on Brain Health, which is the group that I said gives the specific recommendations about brain health over time. So I can share that resource as well. Okay, so and then just I'll leave this screen up. This is just some of the pieces of research that have helped me to create this presentation here. So I will be on for a few moments if there are any questions, but I thank everybody for their participation.
Great, thank you, Emily. It was really
Yeah.
good.
Thank you.
Yeah, thanks.
Anybody have the question for Emily?
Oh, okay, I'm gonna check the chat. Looks like a chat came through. Thanks. Okay. Oh, yes, thank you. You're welcome. Mark, would I be able to send you that link? Are you able to get something out to the participants?
Oh, sure, yeah, whatever you want to send me, yeah, I can send that out.
Okay, great.
This is
Apps that are listed, are any of them like, better than another, or that people have had success with, or?
That's a great question. So I'm gonna play this back up. So I'm actually a big believer that the ones that already come on your phone you can use those primarily. Do you have a smartphone?
Yes.
So the note-taking app, the apps that say notes and voice memos, as well as the calendar and alarm features that already come on your phone are excellent. With the more specific ones that I mentioned, this page here, people really like the one called Todoist. The third one down, I've heard a lot of patients really like that one, and the one above it, Notability. Those two seem to be the most popular.
Great, thank you.
Yeah, of course.
I have a question about speech pathologists working with swallowing problems.
Yeah.
It's very timely because my mom, my elderly mom, just this week started seeing a speech pathologist, and she was surprised, and I was surprised that swallowing was something that person would be working on. What can I expect as far as treatments for her? Because she was diagnosed with this problem a few months ago, and because of her age, they don't think that surgery is an option. So what kinds of treatments will she be expecting maybe to to handle this problem?
Yeah. So it depends on the underlying reason for the swallowing issue, but generally swallowing therapy, there are typically 3 areas of intervention. One is changing the types of foods and liquids that the patient eats on a daily basis. So it can be things like making the food softer or easier to chew, or making the liquids thicker and easier to swallow. So they would probably, most likely give recommendations about the types of foods and drinks that are safest and easiest to eat. And then the second area is, if appropriate, an exercise regimen to work on the coordination or the strength of the swallowing muscles. And then the third area would be things like strategies, much like what we're talking about tonight, strategies, anything from watching the size of how big the bites and sips are, to certain head positions and maneuvers, to anything else besides just changing the food, anything else that can make the act of eating and swallowing safer. So, as I said, exercises, modifying the foods and drinks, and modifying the methods in which you eat and drink, in which she eats and drinks. You can expect therapy to include one or all of those things. So, but if you have any further questions, beyond that, I'm happy to answer, and I can give my email information as well.
Thank you very much.
Okay.
One of the tips that I use, if I can't remember, say for example, somebody's name and it's a man, I'll go through the alphabet. Like I'll say A, is it Albert? Is it Anthony? Is it Andrew? And then nothing's sort of ringing a bell. I'll go to B and C, and then it's D, I think it's D. Is it Donald, Dennis, and that helps me a lot.
Yeah, I like that, because it's like the letter is a cue. It's a prompt to you, at least gets you started. And I think that really illustrates the point that, you know, finding a system that works for you is so beneficial. And, you know, sometimes the first step is just knowing that you like need to do something different to remember names. I like that though. I'm going to steal that one. Okay, there's a few questions here. So great question from Andy about supplements that claim to help memory. This is a really good question because I see commercials for this all of the time. So the participants asking about whether vitamins and supplements, what the research is on that. And so the ones that claim like to promote memory, I tend to be very hesitant of. I usually tell people to talk to their neurologist and doctor, but there is not a lot of research supporting memory supplements, memory vitamins. Some of the other things that we talked about, like eating a healthy diet and exercising, there is actual research supporting those types of things. So anytime you're considering a medication or a supplement, it's best to talk to your doctor. But in my experience, in my practice, they have not particularly been recommended by doctors. If they feel that you are deficient in a certain vitamin, they will target that. Good question. How many times a week should we play a brain game? So you can dedicate whatever amount of time to any activity that you want to do. But what I shared about brain games is what we know from the research is that brain games don't necessarily translate to improvements in your daily life. So one of the things I encourage people to do is kind of not focus solely on a game or an app, but try to learn new skills, do new things. Like, for instance, if you're not proficient with the computer, have somebody help you learn a little bit more. And then some of those different skills and tasks that I mentioned earlier, the idea is that it's complicated and complex enough that it challenges you. Hopefully that answers the question. Is it true that older people can experience brain fog for months after they have surgery? So that's a great question. I don't know the exact research on this, but I have had many patient referrals for post-anesthesia cognitive concerns. So one of the things that when you go and have a surgical procedure, one of the potential side effects is cognitive changes, and it can be short term, and then some people may experience it longer. Unfortunately, I don't have like the exact numbers and statistics on that, but that would be an area where if you had surgery and you have cognitive concerns afterwards, that would be something to talk to your doctor about, because that's something that a rehab therapist like a speech pathologist can help you with. Mark, thanks for sharing my information there. And then somebody shared they also go through the alphabet to try to remember someone's name. So this is an effective strategy. You all taught me something tonight. I'm going to use this one. The first letter tends to help people trigger the name. So that's good. Okay, and then the last question that came in on the topic of speech, can you talk a little bit about voice weakening and scratchiness towards the end of the day, even without a lot of talk during the day? Okay, so that is the topic of voice, which falls under our scope of practice. And the short answer that I'll give you is voice concerns they can be related to many factors, things like not drinking enough water, not getting enough rest, the medications that you're on, acid reflux. There are a lot of factors that can contribute to voice changes. Aging can also contribute to voice changes. And obviously, as you mentioned here, how frequently you use your voice. So the short answer that I'll give is that if you have concerns about your voice quality, changes in your voice, the best thing you can do is talk to your primary care doctor about getting to see an ear, nose, and throat specialist. And then an ear, nose, and throat specialist can have a look at your vocal cords and see if there's anything that looks problematic. Sometimes people have weakness in their vocal cords or a lesion on their vocal cords or something that's contributing to their voice problem. So without knowing really what's underlying, it's hard to answer that question. But generally, if you have concerns about your voice, talk to your doctor and get set up with an ear, nose, and throat doctor. And if anybody needs that kind of information about good physicians in the area, neurologists, ear, nose, and throat doctors, I can help get you that information as well, because I work all throughout the Montgomery County area, and I've worked with a lot of the physicians. So that wasn't a short answer, but I tried. Speech pathologists, we tend to be a little wordy, go figure.
Okay, any final questions from anyone?
Looks like maybe one other thing.
Okay, you're welcome.
Yeah. Okay.
All right.
That was great.
Thank you again,
Everyone was
Emily.
so participatory. I loved it.
Thank
Thanks,
you.
everyone, for joining in tonight.
Yeah, thank you.
And
everyone for
look
coming.
for the presentation on our YouTube channel, and then Emily will be sending me some stuff to forward to you guys a little bit later.
Yes.
Look for your email.
All right.
Okay.
Thank you very much.
All right. Thank you all.
Thank you very much. Appreciate it.
Thank you. That was wonderful.
Wonderful.
Thanks for having me. Yeah,
Welcome.
Here, anytime, anytime.
Okay.
All right,
maybe
take care. Everybody.
I'll come back and just talk about memory, because that's its own.
Okay.
Okay.
We'll
Check
talk.
that one off. Okay. Yep, we will.
All right.
All right. Take care. Good night now.
Bye,
Good
everyone.
night. Good night.
Thank you.